Hi, excuse me. Hi, good morning, everybody. Little frog in my throat. Dr. Val here. Welcome back to another mini webinar with Sleephoria. I've been calling them mini webinars because they're not that long. In my mind, webinar means at least half an hour to an hour. And sometimes these can be 10 minutes, 15 minutes, 20 minutes. I hope you've been enjoying this series. Today is all about mindfulness and self-compassion. So if you don't know what those are, you're in the right place. And if you're looking for non-pharmacologic or supplement-based ways to improve your sleep, you're also in the right place. So let's get started. What do mindfulness and self-compassion have to do with sleep? Well, here we go. So first, let's define what mindfulness is. Mindfulness, and I like to take the definition from Dr. John Kabat-Zinn. He created a program called mindfulness-based stress reduction. He's sort of attributed as sort of the father of mindfulness and brought the principles to the US after he was studying in Thailand and learned about Buddhism. And so they're really helpful principles, but dis- the way he defines mindfulness is being present here in the moment. It's moment to moment awareness. And if you really think about it, where are we really right now? I'm in my room, which is also my home office, and you may be watching from your own living room, from your couch, or even your car, or wherever you may be. And so that's just where we are. It's being present in the moment. But the other side of mindfulness is to see the moment clearly without any judgment. And that whole judgment part is really what's impactful to someone's sleep. Because oftentimes, what I hear in my medical practice is that someone can't sleep because their mind is racing. Sometimes they feel like they're a bad sleeper, especially if they've had insomnia for quite some time. And those negative thought patterns can actually impact the quality of sleep that you have. Because when we take a look at what sleep is, and if you've been following me for some time, the way I like to describe it is that sleep happens when your brainwaves slow down. Yes, there's other biological processes such as your homeostatic sleep drive. The longer you're awake, the sleepier you get. And then your inborn circadian rhythm that's based on light, darkness, and melatonin that affect your sleep. But even if those systems are running really, really well, and if you have a hard time sleeping, a lot of times it's because you're very aroused. And so, how do we reduce that arousal system? Well, mindfulness and self compassion are really excellent ways to do so. So, let's talk a little bit more about mindfulness. So, mindfulness is being here right now in the present moment without any judgment. And when you take a look at the teachings and principles of Dr. John Kabat-Zinn, he has seven basic principles. And so we'll go through each of them. They are beginner's mind, non striving, letting go, non judging, acceptance, trust, and then patience. And how can that impact one's sleep? Well, let's go through each one. The first is beginner's mind. Can you see the situation with a fresh start and a clear perspective? For people who have kids, I think it's a little bit easier to understand this principle when your kids are really little. You're reading books about the zoo, all the different animals. You're reading about the elephants, you're reading about the zebra, and then you bring them to the zoo. So I have a 2 year old, and recently went to the San Diego Zoo for their spring break. And it's like, wow, like seeing the elephant so big in life in person. And he even had his little zoo book and was bringing it and showing it to elephant. So um, using that mindset, seeing things like with excitement, with a fresh start, with a clear perspective, almost as if it's the first time you've experienced it. Because what can happen a lot of times with people who have difficulty sleeping is that our past can bias us, especially the negative experiences. And sometimes folks who have insomnia or difficulty sleeping, that, every night is just going to be pretty awful. It's just going to be a repetition of the previous several nights or several weeks or several months. And then we start to worry. We lose confidence in our ability to fall asleep, and that can really impact our sleep. So, can we approach the situation with a beginner's mind? One of the principles of mindfulness. The second is non striving. And, you know, I've heard Dr. John Kabat-Zinn, say we're human beings, not human doings, right? I think we're all constantly doing things. Our schedules are really packed. Um, and can we just understand this principle of we're just here now, being open to the present, not really trying to change anything or wish it was different or wanting to be elsewhere? Can we just sit with the comfortableness of our bed, the uncomfortableness of not being able to fall asleep? Because when we understand really what sleep is, right? I mentioned those two biological processes. Sleep is a process that should just be allowed to unfold. And this whole principle of non striving allows us really to balance out our desire and our want to go to sleep versus allowing sleep to come. Sometimes when I describe this to patients, it's, when you're exercising your muscles, you're contracting them and then you're relaxing them, right? If you're doing bicep curls, you're lifted and then you're relaxing. Sleep happens in that relaxation phase. It's not like something that we're forcing ourselves or tensing up to do. It's how can we allow ourselves to relax even more to go to sleep. So that's the principle of non-striving. The next one is letting go. Expectation to attachment, not to an outcome. It doesn't necessarily mean giving up, but it creates a shift in a relationship to the problem. Sometimes we have pretty traumatic and really uncomfortable past, and those things can really creep up at night. When it's dark and it's quiet and you're left to your own devices with your thoughts, what can happen? We can think about the past, we can think about our regrets, we can think about our guilt. And sometimes those thoughts can really consume us. And especially if you've had a trauma that happened, when you were sleeping or at night. I certainly have had patients who were robbed, who were assaulted at night, and they just don't feel quite comfortable sleeping. And certainly, I'm not a trauma expert. And so, if you had gone through that, I definitely would recommend speaking with a really good therapist about it. But can you get to a point where you're thinking about this whole principle of letting go and really not letting your thoughts, feelings, or attachments to insomnia consume your life? I definitely have worked with patients who have been this in this state where they don't go out to dinner at a certain time with their friends, or because they have to be back home to do their nighttime routine. They avoid certain social situations, even certain jobs, because that job will sort of require them to work a little bit later, and it really can consume their life. So learning about this principle of letting go doesn't mean you're giving up, but it means that you're shifting your relationship to the problem. The next is non judging. What is non judging? Well, as a medical doctor, definitely, I feel like a lot of what I do is judging, reading people, asking them questions, judging them, or diagnosing, I guess is the way we would technically call it. But sometimes it feels a lot like judgment. And can we get to the point where just we're observing the moment? Because what can happen if you have a lot of judgments about yourself and your ability to sleep, it can impact your ability to sleep. What do I mean by that? Because sleep happens when our brain waves slow down. And so if there's a lot of negative thoughts and judgments, that can cause our stress response to increase, which is the opposite effect that we have when we want to sleep. So negative energy and thoughts can lead to more sleep disruption. Acceptance. So can you just say, yep, I'm not great at sleeping and that's okay? Which is really hard for some people because, sleep loss can lead to a lot of physical symptoms the next day. I know for me, I can get like headaches. I can feel really drowsy, just want to lie in my bed. My brain doesn't work as clear. I have some brain fog. My memory can be affected. And that's really hard to accept, I'd say. But if you are able to come to a point of acceptance and acknowledging what is present, then you can sort of shift your relationship to the issue, right? Take an active choice to make some decisions and take action, because acceptance doesn't mean like, all right, this is just the way life is and I'm never going to be able to improve my sleep and I shouldn't even try. No, that's not necessarily what acceptance is. Acceptance is really acknowledging that there's not this button that we press that makes us go to sleep, that sleep is not directly controlled. Excuse me. Another principle for mindfulness that can impact our sleep is trust. So, can we trust that the mind and the body can actually self regulate without our direct interference? And when you understand the real science of sleep, what's going on in your brain and your body, And understanding even why you have insomnia in the first place can lead you to improve, your thoughts about sleep, maybe improve your confidence that your brain is not broken. And I was going through these slide sets that I have here on my right, which I can't share with you folks, but if you do want them, just let me know. I can put them in the chat. And I mentioned this part where, your brain isn't necessarily broken. I like to think of it as you have the sleep software, and there's just some broken links, or the programming is a little bit off, and that's something that we can definitely help you with. One patient told me, "No, I had a doctor and my psychiatrist said my brain is broken." But I don't really view my brain as broken because I view my brain as being really unique. And I really like his sort of more, um, his mindset shift around that, because when you put yourself down a lot, it sort of puts you in this box. And there's almost no room for growth. So, really having more of a neutral to more positive outlook can really be beneficial, especially if you're wanting to change some of your behavior, especially around sleep. And the last one is patience. So the seventh principle is patience. And sometimes, just trying to understand the timing of life. We don't always understand why things are happening to us, but events will unfold with time. You maybe stumbled across this video, or you've met someone who had difficulty sleeping and they've gave you some tips, right? And sometimes results do take time. They don't necessarily happen overnight, but learn to be patient with the process as opposed to like really wanting to fix things right away. Certainly, I've had some folks with after a week or two of meeting with me, their insomnia has really gotten so much better. And sometimes, there's folks still working with me for several months to even over a year. So, be kind to yourself, be patient. I'm going to run through these seven principles again. There's beginner's mind, non striving, letting go, non judging, acceptance, trust, and patience. Yeah, so those are the seven principles of mindfulness. And there's a whole program by Dr. Jason Ong, who's a researcher in insomnia, basically combined mindfulness based stress reduction, which is a program that Dr. John Kabat-Zinn created, and combined it with cognitive behavioral therapy for insomnia. And it works really, really well. Some of the clinical trials have like really good outcomes. The next thing that I want to talk about, just shifting gears a little bit, is to self compassion. And so, what is self compassion? It does have a lot of similar roots in mindfulness. So, there's three main components. It's really non-judging, being kind to yourself. The second is common humanity. What you're going through, others are going through as well. Because sometimes if you have difficulty sleeping, it can be really isolating, especially if you have a bed partner that's fast asleep, falls asleep really quickly, wakes up feeling refreshed. Sometimes that can really impact your ability to fall asleep because you're seeing them night after night sleeping so well, and you're like thinking, "Oh, why can't that be me?" And they have people envious of their partners. And then the third part, so I said common humanity, kindness, and then mindfulness. And so those are sort of the three main components of self compassion. And one of the biggest reasons why I'd say mindfulness and self compassion do improve someone's sleep is because a lot of the times, right, what can happen is that arousal state. We have these ruminating thoughts. I'm such a bad sleeper, or I can't relax my mind. I need to take something. Oh, why did I drink that coffee? But I was so tired and I just needed to finish this project at work. And so sometimes our mind just keeps going and going and going. And learning about these principles of mindfulness, learning about self compassion is really helpful because it helps you be kind to yourself. It takes away some of that rumination. Yeah, and so they've actually have been a meta-analysis that I'm seeing here of self-compassion, and it actually improved sleep quality, right? So if you're learning how to change the way that you talk to yourself at night, and one good tip that I can recommend is create a pro sleep mantra, right? Is there something that you can tell yourself that'll help relax you, help you be calm? If I'm not asleep, at least I'm resting. I'm learning how the principles of mindfulness can help keep me calm and thus lead me to sleep. I can figure this out. I accept that I have difficulty sleeping. So I always encourage folks to come up with their own mantra because it's more real to you. And when it's more real to you, you believe it more and it's more impactful. So come up with a pro sleep mantra. That's number one. Number two, I recorded a self compassionate body scan. So part of mindfulness is really slowing down the breath, taking a look inside. And when you have a lot of ruminating thoughts, what's helpful is if you can anchor it in something. So, thinking about your different body parts can be really beneficial. And I have that also on the channel. So, you can take a look at that. And the self compassion part is you're bringing in parts of gratitude into different parts of your practice. So when you're thinking about your knees, thanking your knees for all that it helps you do, for helping you walk, thanking your brain for all that your brain has done for you to helping you think. Your eyes, all the things that you've seen with your eyes and all the things that you're able to read and learn because of that. So I feel like self-compassion goes a little bit deeper. And I almost think it's the antidote for folks who have insomnia and anxiety related insomnia. So I hope you found this video helpful. If you have any other questions, go ahead and put them down in the chat. Otherwise, I'll see you at a next mini webinar with Seaphoria. So this is Dr. Val. I'm the CEO and founder of Seaphoria, where really it's our mission to help women learn about proper sleep health and whole living, with our mission that a well-rested woman has the energy, clarity, and drive to change the world. So thanks for being here. Have a great rest of your day. Bye-bye.